That was funny. Who gave her a hard time?
Nobody put the front row anyways. We were all good in the front row.
All right, who's excited to be here?
Yay!
Woo! You got a couple of liars in here. That's okay. So, super quick review. You guys know that there's two sides to your brain, right? You guys probably remember that the right side of the brain controls the left side of your body and vice versa. You guys have heard that before, right? So you have the right side of your brain, left side of your brain, and that crossover takes place. Anybody know where that crossover takes place? That crossover from right to left and left to right is an incredible important junction, because that means no matter what happens there, it can have an effect on either side of the body from top to bottom. A lot of it takes place inside the brain itself, but most of those fibers also cross over right at the level of the atlas. So the atlas is the top bone in the neck. You probably remember that. Most of the bones have different names or numbers to them. The first one is the most important one. It's called the atlas. It'll be the one that we always check on you first to see whether or not there's an imbalance there. And the reason why it's so important is this. This should be a quick review, hence the speed of my of speech. So the nerves from the neck, you guys remember, they go up into the head. So they do the neck and up into the head. They do the neck and a little bit down between the shoulders, and then they go down the arms and into the hands. So if somebody has a subluxation in the neck, the types of symptoms they get would typically be in those areas. So that would be either headaches, chronic ringing in the ears, sinusitis, thyroid issues, neck muscle stiffness, numbness and tingling in the arms, cramping, things like that, based on where those nerves go. Is that a review for everybody? Just shake your head with me. Okay, perfect. Between the shoulder blades, those are the nerves that do the heart and the lungs. And a little further down, you have things like the gallbladder and the stomach and the pancreas, etc. That's going down the spine. And then as you get down to the lower part, you get the nerves that go down the low back, but also down the legs into things like the bowels and the bladder and the sex organs. So each area of the spine is intimately connected with particular vital organs. The atlas, though, the one where that crossover takes place, this is what it controls. So it's the only spot in the whole body where every single nerve goes right through it. Okay? There is one other spot, though, that affects everything, and it happens to be the tailbone. Because at the bottom of this spinal column that comes down is a bone called the sacrum with the tailbone at the end, and the nerves physically attach at that point. So the nerves physically attach at the top and the bottom, and so therefore problems at the top and the bottom have a greater impact. You guys remember that the brain is protected, of course, by the skull, and you have all these spinal bones all the way down. So these ones go into the heart, and let's call that, that's a lung, there's a lung. I have a lot of talents. Drawing's not really one of them. You have the liver over here, and the gallbladder, and the stomach, and the intestines, etc. are all controlled by the nerves all the way down. And of course, you have your legs coming off here, etc. So when the brain can talk to all the different parts of the body the way it's supposed to, they call that ease. And the reason it can do that is simple. What does the brain do? The brain does three things, okay? The faster you answer questions, the quicker we're out of here. So give me something that the brain does.
Everything.
So it controls all functions, which is another way of saying everything, right? So the brain controls all functions. So why is that important? Well, right now your heart is beating, your lungs are breathing, you're fighting off infection, and you're making brand new toenails and kidney cells out of the food that you ate yesterday. Those are all the different functions of the body. You're able to get up and walk, you're able to hear what I'm saying, etc. Those are all functions of the body. They're controlled by the brain through the nerves. The two other things that the brain controls, and this is why it's so relevant to make sure that the brain-body connection is clear, is that the brain also controls all healing. So all of it. So for your body to heal from a lifting injury, a car accident, a stress from your day. Does anybody ever have a stressful day? Okay. So
Just coming here.
Just what?
Just coming here.
Just coming here. Just stress. Oh yeah, through the traffic and,
Over here.
and that construction. I know. It's supposed to be another 5 months there. I know. 5 months for like this little stretch. So. But they're terribly efficient at standing around. It's unbelievable. So I digress. So stress. But the reality is, the moment that you have stress is good or bad for you?
Good.
Sometimes good.
Okay? So how can it be both? Stress is good for you when it's inside your body's capacity for adaptation. So as an example, if I wanted to stress my muscles by lifting weights, that's good for me if I'm lifting 15, 20 pounds. But if I try to lift 300 pounds, it's a stress that's too much for me, and my body starts to break down. So as soon as the stress is outside your capacity for adaptation, it has a breakdown effect. The reality is, most people have stress just at one small point during the day and then never again for several weeks, right?
No.
No, it has a building effect. That's the challenge of it, is that they say we have more stress in a day than we did in an entire month 100 years ago. But our physiology hasn't changed so much, right? In terms of demand, so the demands that we put on ourselves, and so we got things like cell phones, which make our life a lot easier, right? Because then you can make phone calls and it saves you all kinds of time, so you don't have to wait till you get home to make them, right? And having email on your phone made your life much, much simpler, so that you can work by 2-3 hours less a day. Is that true?
No.
No, it's actually worked the opposite way. So when you kind of look quizzically at me about why there's more stress, the reality is that we're trying to accomplish more in a smaller period of time than we ever made ourselves responsible before this time. And so healing on a day-to-day basis has to take place. And then the third thing the brain controls is the creation of all new cells. So every single day you make millions and millions of new cells under the control of the brain through the nervous system. If those cells are made as unhealthy cells compared to the ones you had before, then your body is building ill health. So that would be the person that over time is gaining weight, losing muscle, getting sicker, etc. Right? The person who's increasing their health over time is replacing their unhealthy cells with healthier cells. And over time, they're building a healthier body over time. When you have a subluxation, the moment that you have a subluxation in the body, right? This doesn't happen, and you end up getting this, premature aging, okay? When most people think of premature aging, they tend to think of their looks, right? They think of their skin, etc., hair color, whatever the case is. Premature aging is what happens when one part of the body is not connected to the brain as efficiently as it could be. So as an example, at the beginning we talked to you about the different phases of degeneration, right? You guys remember this? Some of you guys, it's been only a year since you've had that report. Some of you guys, it's been several years, right? So for somebody like you, we just started adjusting you. How long have we been adjusting you?
A couple of years now.
A couple of years?
It's so long, I don't remember.
Yeah. Was I married when you started?
I don't know.
I might have been still available. How many years?
I think, well, James is 15, I think he was 2, so probably 13 years.
13 years?
About 10 years.
10 years?
About 6.
I think it's more than that.
Could be wrong.
How long ago did the kids move up north?
6 years ago.
And I was taking care of you before they moved.
Yeah, it's about 7.
And I took care of them for several years before they moved, like 6 or 7
Maybe
years.
8, I don't know. I
Yeah.
don't remember.
We must have an anniversary coming up.
Yeah?
Probably a decade.
At least a decade, yeah, for sure.
Long time.
Yeah. You're more than a decade for sure. How many kids did I have when you started? That's how I measure everything. Was I married, or how many kids did I have? You remember?
One, I think, or 2.
Yeah, so 10, 12 years anyways.
I was thinking about 7 years.
7 years, yeah. So everybody's
I think we're
differing.
about 15,
15 years? Yeah.
something like that.
Yeah. So everybody's differing lengths of time. And the whole thing is, in that time, everybody has aged. Okay? I know that sucks. And we're going to continue to age. But the whole goal is to not prematurely age. Because if you have a subluxation that affects one area of the body, so a subluxation that affects this area will cause a degeneration of that disc. A subluxation that affects it for many years will cause a breakdown in the bones. These are ones that you can easily see on x-ray. But the same thing happens if you have a subluxation going into the bowels, or subluxation going into the bladder, or subluxation going into the heart, is that it ages prematurely. We all want to be okay with the fact that we're aging. You have to get over that. But nobody wants to prematurely age, especially because if you have one spot in your body that ages faster than everything else, it really is the spot that holds you back, isn't it? Right? Like if you have one bad knee, you could be in perfect fitness, you got one bad knee, you're not running anymore, right? Bad back here, chronic headaches, whatever the case is, one area ages prematurely, we don't want that. So the moment that you have a subluxation, if somebody said to you, you know, your doctor adjusts subluxations, what exactly are those? What would you say?
There are areas in the body that aren't working properly, or preventing other parts of the body from working properly.
Okay. What would you say subluxation is?
Misaligned.
Misalignment?
Misaligned.
That's how you'd say it?
Right down here.
Breakdown? What'd you say?
Oh, I don't know.
That's probably exactly what you'd say. I don't know. Call him. Yeah. What would you say?
Well, it corrects the issue so that you continue not to have premature aging.
The adjustment would do that.
Yes.
Yeah. So what's a subluxation? So a subluxation is a misalignment for sure, but it's more than that because you can have a misalignment and not be a subluxation. It's a misalignment that also interferes with the nerve. That interferes with the way the brain is communicating along that nerve pathway. Sub means below, right? Ation means condition, and lux, does anybody remember what lux is? It's a physics measurement. Come on, impress me, guys.
It's too early for that.
Early. It's a
Having
measurement
coffee.
of, it's a measurement of light. So it's a condition of less than full light, a condition of less than full life, right? When you have a subluxation, right, how long do you have before permanent cellular damage takes place? How long is it?
2 weeks.
2 weeks, yeah.
2 weeks, right? So how many of you knew that? Okay, now you just filled, it's interesting because you just filled out a form, and on the form, the last one that you just filled out, it says, the first sentence below your name says, recent research has shown, and then it says vitamin A also. Tapio Vitamin was a Finnish researcher, the first guy to show that when you have a subluxation, you have 11 to 13 days before permanent cellular damage takes place. What is your current frequency of adjustments? And then you have the line where you fill in how frequently you're getting adjusted. How many of you remember reading that line? Which is why we often still have the report, because we don't necessarily read stuff. So you have 2 weeks, which is why when people are on wellness care, we typically have them at once a week or once every other week. It's not like a number you pull out of the air and think, well, that's a neat idea to do it at that
I
frequency.
didn't get a report.
Sorry?
I didn't get a report.
Yes, the form that you filled out when you had an exam. It may not have been your last one, yeah. Because you guys are on the holidays and whatnot, so it may have been before. But either way, that's what it is, right? So it's that 2 week timeline. And so when people are getting adjusted at every other week, that's enough to keep their body from prematurely aging. Now, who would need to get adjusted more than every other week? Somebody who has more what?
Chronic pain.
Injury.
Stress, which can come in the form of chronic pain, injury, emotional stress, major demand, and everybody goes through periods of their life where they have more or less of that. True? Right? Sometimes we feel good and sometimes we just don't. Sometimes we're having a good, relatively stress-less month, and sometimes it's overboard. Is that true? It's during those times that I encourage you to say, okay, I recognize the fact that my body's under massive stress right now. Let me go in and get my spine checked. And so while we say, you're every other week, that's more of a guideline. And then if you need to be here more than that, please let us know. Because how do you get the stresses? So you guys remember this chart here? Okay, how many of you have seen that chart? So this chart here, this is the equivalent of a, what's it called in your car? A tachometer. You know the speedometer says how fast you go, but the tachometer says how hard the engine's working. Yes? So the red zone would be good or bad for your car?
Bad.
Okay, so let's use that analogy. So if you take your car and you drive it in the red zone, would you expect in the short term for your car to work better, have better or worse performance in the short term?
Work okay.
Be better in the short.
Yeah, be better in the short term, right? So as an example, you and I are racing, from here to there. I'm going to drop it into the red zone to beat you there. In the red zone is when I get the greatest production out of the car, but unfortunately, it's a red zone for a reason because it's not sustainable, right? So if I stayed in the red zone, would I expect that car to break down faster or slower? Right? Would I expect that car over time to require more or less maintenance?
More maintenance.
Right, which is why like a race car requires more maintenance than the one that you drive around. Because they're driving it harder, trying to get better performance out of it. Have any of you you guys understand the analogy of your body, right? Is that sometimes you just drive yourself to push through it because life demands that you do. And there's so many demands on you, but you just keep pushing through it because for whatever reason. Has anybody ever felt that way?
Mm-hmm.
Right? Sometimes several times a day, right? And you can get away with it short term. But I'm the guy who's on the other end, not seeing whether or not you have stress. I'm seeing the effects of stress on your body. And I can tell you that you die of one thing. You die of stress. When the outside stress in your body is greater than your body's ability to overcome your internal resistance, you break down. Your innate cannot respond at the rate you want it to. So being in the red zone is the equivalent of hitting the gas pedal. It's what's called sympathetic overdrive. You guys have you ever heard of the fight or flight response? Right? So fight or flight response, fight or flight is where your body goes into sympathetic overdrive. It's in a chronic state of stress. So let's say as an example, this door flies open, right? And in walk 3 guys, 6'6", long trench coats, covered in ski masks, and they all kinds of weapons, okay? And they just walk in and they go, "Where's Mike?" And Mike, first thing he does is point elsewhere, right? So what happens to everybody's heart rate when those guys come in? Goes up. So you remember this chart here, the yellow and green nerves? The yellow nerves are all the nerves that turn things up, and the green nerves, you'll notice they only come from the atlas and the tailbone, are the things that calm the body back down. Okay? So everybody's stress goes up, because when you get a subluxation, it's the exact same thing as being majorly stressed. So these guys come in, your heart rate goes up. What happens to your breathing rate? It increases. What happens to your digestion?
Stops.
It shuts off, because your innate intelligence says, I don't really care about digesting that chicken noodle soup because I'm about to die. So I'm going to direct all attention to the heart and the large muscles of the legs so that I can get up and either fight or run, fight or flight. You get that? When the body's in a state of stress, those things happen. What about your immune system? What happens to your immune system when you're stressed?
Stops.
It weakens, right? People already know they get cold sores when they're the most stressed, right? And a lot of times people come in, they get a cold, and they come in for their immune adjustment. I can tell you, there's no such thing as an immune adjustment. There's just a way to say, evaluate, there either is or isn't pressure on the nerve. If there is, when I remove it, your white blood cell count will go up significantly within a half an hour, which will help your body fight this infection faster. So a lot of people, they come in, they get an adjustment, the cold goes away quicker, they feel like, well, that was an immune adjustment. All it does is restore your body back to normal. So here's what happens when the body's stressed. Misalignment, tension, and fixation occur in the spine. That's called subluxation, right? So the stress response happens and the body gets stuck in flight or fight. So when you look at it, you have things like seizures, asthma, muscle spasms, pain, behavioral issues, constipation, anxiety, headaches. Well, let me explain that. If these guys are here and your body's tense because these guys are here trying to kill you, if they never went away, could you understand that muscle tension would turn into muscle spasm over time? So chronic tension and spasm in the muscles is common when somebody's subluxated. If you're under massive pressure, your blood pressure is skyrocketed because these guys are going to kill you, after a while, that could trigger some tension in the neck and a headache. Chronic headaches as a result of an inability to get rid of the stress. What about things like constipation or acid reflux? Well, what does your digestive system do when you're stressed?
Shuts down.
Shuts off. When it shuts off, so when you're subluxated, your digestive system shuts off. When it shuts off, you're more prone to those types of things. What about things like ADD and sensory processing disorders? Think about it. These 3 guys are trying to kill you, and I'm trying to teach you math.
Not gonna work.
No, your ability to focus isn't there because your nervous system is in fight or flight response. Your calm down nerves, the ones from the atlas and the bottom here, right, are in a state of massive dis-ease. And the worst thing you could do to try to get somebody's attention who's in that state is lock their pelvis into place by making them sit down. So we put these kids in the classroom, have them sit there where their pelvis is locked. It turns off the ability of these green nerves to be able to calm anything down in the body. And then we have them sit in this position, which affects the atlas, and we want them to focus and concentrate. It's a physiological inability that they just can't do it. So the second that they get adjusted, they're better able to facilitate those challenges. When you get adjusted, that's the equivalent of me stepping in and just hitting a brake pedal on your car. right? You got your foot, maybe both feet on the gas, right? Maybe your friend's feet are on the gas too, trying to get as much out of it as possible, right? Or your boss, right? Sometimes the boss's foot is on the gas pedal trying to drive you as hard as possible. The brake pedal is where the parasympathetic nervous system comes in, the calm down system. So the chiropractic adjustment removes the subluxation, rest, relaxation, digestion, and immune function resume. Well, why does rest and relaxation? Well, if those muscles are not under chronic tension, then the body goes into a more relaxed state. Digestion and immune function can resume because the stress is taken away. So growth, healing, and development are restored. Remember, the brain controls all function, all healing, and growth and development is this. So the moment that you're getting clear of subluxation is the moment that any premature aging in the body stops. That's it. Now, sometimes you guys come in and you get adjusted in 2 spots, and sometimes 5, and sometimes 1, and sometimes none, right? So some of you guys have come in this year clear a few times, right? And if you've come in clear, if you start coming in clear regularly, that would be when we start talking about changing frequency. So if somebody comes every single week, and after a while they start coming in clear, then we know that they can go every other week. If you're coming every 2 weeks, and you start coming in clear all the time, then we would start to move it to 3 weeks. Not because I'm unaware of this 2-week time frame, but because your body seems to hold adjustment better, or you have less stress in your life, etc. Does that make sense to you guys? So outside of this then, the reason that we always talk about the exercises, you know those things? You guys remember those things? Yeah. You guys remember, like, we've had things that look like this, right? Or a gray wedge, or somebody who loves you has spent time to give you different exercises. Does anybody love you enough to do that with you? Okay. What's that?
Never saw one of those.
Well, these were created after you started chiropractic care. It's true. Yeah, it's true. I started using them, I think, 14 years ago, so it would have been right after you started. And so when you're going through that process of using something like that, or somebody's giving you exercises, right, or stretches for you to do, how many of you guys still do them regularly?
Which,
Any of it?
that daily.
That daily, so you use the traction daily, awesome. You do these stretches, right? Most of us tend to do the stretches and exercises that we feel the most immediate benefit out of, isn't it? Usually that's the habit. So I'm going to encourage you to try and break that habit. I'm going to encourage you to do the ones regardless of whether or not you feel an instant change. It's like the person who eats one good healthy meal. They don't feel instantly different, but you do a series of those back to back, it creates a different pattern over time. Our goal is to have you do things before your body requires it from a symptom standpoint. Does that make sense to you? So as an example, the nerves that come out of the neck, the atlas are the ones that are all the calm down nerves. If you're going to do anything, you get more bang for your buck by doing stretches and exercises that have to do with the neck than it will for any other part of the body. The second most important part is around here. So the better shape you're in the lower abdominal area, kind of the butt and the thighs, and the upper part of the neck, the better off you'll be. Every older person who's super healthy walks like this, right? I'm being facetious, right? They're the opposite. They have an upright posture and they have a range of flexibility. They can take a longer step, they're not shuffling, etc. The healthier you are, and I could talk to you for hours about why that's so, but at the end of the day, that posture is the most ideal posture for producing health and being able to withstand stress. So if you're going to do anything, I would say to motivate yourself to redo some of those exercises that we've given you. If you're not sure how to do them, or maybe you've lost the sheet or you want some direction on some new exercises, I'm so happy to give them to you, okay? What I used to do at this report was give you all kinds of stuff to do and then basically make you feel guilty about what you're not doing. And I never intended that, but I know that I've done it. So if I've ever made you feel guilty about not doing stuff, I apologize. But it's always been from a heart space of, you know, this is the best thing for you and I can't not tell you about it. So at this report, oftentimes patients for over the last decade have used this as a continual reset point where they refocus on something, anything. It could be walking every day. It could be doing your planks or wall sits or your traction unit or whatever the case may be. If you're not sure exactly what you can do or what could be a priority, ask me about that. and I'm happy to share that with you. So when Lindsay said at the beginning, you know, afterwards you can take off, well, I don't want you to take off if you have questions, right? So if you have questions about, you know, what kind of exercise can I do? I have a bad knee, so what can I do? I have all of that knowledge in here, but instead of kind of jamming it down your throat, I'll have you ask me about, you know, whatever's important to you. Is that reasonable to you guys? Okay. For those of you guys that still, I think most people have had their adjustment. If you still have an adjustment, we could do that now. For those of you guys that you came in and your request for going forward was the same as what we recommended, then Lindsay would have already talked to you and given you kind of your schedule and stuff, so you're free to go. One or two of you I needed to chat with very briefly, but other than that, you guys are set for today. All right. There is one other thing. There's only one time during the year, or 2 times I guess it is now, that you can refer a friend or family member for no charge. It's usually always just at Christmas, and then the other time we've made it available is at disappointment. So basically, at the time when you have sort of your renewal, if you had people in your family that you wanted to get checked, then they can do so for no charge at this point. So it saves them $150. I think for most of you guys who take care of your whole family anyways, but you guys certainly have friends or family members that might apply to. So if that's of value to you at all or of benefit to you at all, then you just let them know up front and they'll give you a gift card for that. Okay, guys? Awesome. Everybody have an amazing day today. Thank you. Okay, thanks, guys. Okay.